Friends, let me ask you first question at the starting of my lecture. Okay, is there any field there is no struggle to get success? No. Good. Excellent. Now, I am talking on physiotherapy as a career point of view. And I am going to explain what exactly physiotherapy is. Right? So, physiotherapy is what? It's a healthcare profession as well as a branch of paramedical which helps to promote the human function and mobility and better quality of life. You got the what is physiotherapy mean? Or I'll explain more about it. Yeah. When the patient comes to the physiotherapist, what we do, we first examine them, what is exactly problem, what happens to him, what injury he has happened, and what exactly paining, where it is paining, and which muscle it affected. So that we examine, and then we decide the protocol for the treatment. Treatment plan. After the treatment plan, we give the proper treatment, and we also advise him what to do and what not to do, how to sit, how to stand, how to walk, everything. So we make him independent and pain free from his life. Now you got? Or any more about the physiotherapy? This is just a definition I am giving. I am going to talk about more. Okay? Now, being a physiotherapist, what is a qualification required for it? For the sighted person point of view, it's a 12 science required, and for the VI person, it's a 10+2 means HSC in arts also will do for the physiotherapy course. And courses are going on in Bombay, Mahalakshmi Rehabilitation Center of branch of NAB, and in Ahmedabad there are two places. One is Vastrapur, that is Blind People Association. Their certificate course is going on, and Bombay also certificate course is going on. And in Navrangpura, I think it's name of the area Navrangpura, Ahmedabad only. Diploma course is going on by Ambedkar University, and that institution is for the blinds and for the other multiple handicapness. So this is the qualification for the physiotherapist. Now, what is the role and scope for the physiotherapist? There are mainly 3 points which are really we have to play important role in the patient's health. First is prevention, then treatment, and rehabilitation. You know the famous proverb, prevention is better than cure. What do we prevent exactly? Suppose patient is coming with the joint pain, knee pain. Pain because of what? As the age grows, patient gets degeneration in his joint. Many structures are there, cartilages, synovial fluids, bone, articular structures, means where the joint is occurring. So that structures are getting degenerated, means they are getting dried or they are erosed with each other, and that powder comes in between the joint and joint gets pain. So we have to delay his degeneration. We can't prevent the degeneration, but we can delay that degeneration. So we have to advise him ki you do these exercises for the particular joint muscle, knee muscle. So you will delay your at least by the 3 years or 5 years you will delay your degeneration. But degeneration is going to happen, but we are delaying it. So that is also one kind of prevention, isn't it? Okay. Then what we can prevent? Suppose a patient of paralysis. In the paralysis, muscles are spastic. Spastic means muscle kadak hona. They are getting tightened. So to prevent that spasticity, we have particular aim of treatment ki full range passive movement karna. So in full range of passive movement, we are giving patient full passive movements as well as particular techniques of massage. So we are preventing spasticity. So one of our role to prevent prevention. And after the prevention, patient is really not getting help with the prevention, and he requires the treatment. Then we are come to the treatment part. What we are given exactly treatment? We have many techniques of treatment. We have Stretching. Stretching means if muscles are tight but not in the paralysis, you are working on the computer and your shoulder ka back muscle and lower back muscle are getting pain because that are in the long time for the one position and that are giving you pain. So we have to stretch that muscle and release it and improve your blood circulation. So we are examining you ki what exactly posture you are and which muscles are giving you trouble, that we examine and then we are deciding the plan and we are giving to treatment. If the same patient, paralysis patient is coming and prevention is not working for him, then we have to decide the treatment also. We have we have to see the first patient is on which stage, whether he is acute stage, acute means just it happened, or we are in the chronic stage, means he is for the long term treatment. So we have to decide the proper protocol for it. For example, patient is for the spasticity. Same we will take the example. Patient is for the spasticity, and we have to give the proper treatment. We have to give advice because daily we can't treat the patient in a hospital. Patient is going to discharge any time. So we have to give the proper advice to patient's relative, or we have to arrange the therapist at home. We are giving patients do icing, ice fermentation, means apply the ice on the particular muscles. So that is a treatment. We have to give the full range of passive movement continuously at the home also. We are teaching to patients also ki you have to do these movements like this. So if patients are not doing, then therapist is coming at the home also. So that is the treatment part. Even we are using electrotherapy in the treatment part. Electrotherapy means what? Certain modalities of electric, like shortwave diathermy, that is a heat modality, we giving heat to the patient. Then interferential therapy, that is also current, gives the currents to the muscles. Then ultrasound, this is a particular modality which gives ultrasonic waves in our body and getting pain relieved. Then electrical muscle stimulation, when the muscles are complete paralyzed, then we give the stimulation by electricity, the muscles are getting activated by it. So electrotherapy also we are using for the treatment part. And again, next part we are using is mobilization of the joint. This is related to the orthopedic patients. When the arthritis patients, mean joint patient comes or back pain patient comes, we are giving him joint mobilization. We are keeping the joint in particular position and we are moving their joint artificially by our hand manually. We are not asking him to mobilize himself, we are moving it. Means that joint gets moved and he will get automatically relief in it. And next part we are using in treatment is exercise therapy. Electrotherapy is done, stretching, mobilization, and then exercise therapy. Now, why we are getting joint pains? Why we are getting our muscle spasm? Because we are sitting in a wrong position to operate the computer. We are walking excessively, more than our necessity or more the capacity of it is out of our capacity of our body. That's why we are getting pain. So our muscle automatically goes into weakness. So we have to, therapist has to decide which muscle is weak for the which joint. For the knee joint, which muscle is weak? Quadricep, hamstring. So after recognizing it, we have to give the particular exercise for that muscle. Means for the quadricep, there is different exercises. For the hamstring, there is a different exercises. Right? You're getting it now what I'm talking? Thanks. Okay. So to strengthen the muscle, exercise is required. But I am getting knee pain and I am strengthening your foot muscle. That will not be work for the patient. I have to recognize proper muscle which is the weak. And there are the techniques also to check the weakness of the muscle. So after doing that, we are giving exercise program, we are teaching patient at our hospital, and then we are asking him to do, we are giving diagrams also to him, right? So this is treatment which I wanted to talk to you. Now next part of role is rehabilitation. Now we are trying everything. Prevention we are trying to do, we are trying to do treatment also, but it is really not curable. Some diseases are not curable because they are related to the brain, they are road traffic accident, they are really can't be treated. Then we have to think rehabilitation part. What was the job patient was doing before his accident or before his paralysis, and what his condition current, and what he can do next. We have to think that. And to do rehabilitation, there is no one member particular. We have a team of the member: orthopedic surgeon, psychologist, social worker, occupational therapist, physiotherapist, and physiotherapist is one of the important part of team. Without physiotherapist, each and every surgery is fail, absolutely fail. Because when you do the cardiac surgery related to the heart or lungs, you do the heart surgery, if physiotherapy is not given, many chest complications, many secretions will remain there, and patient may die also. So without physiotherapy, every surgery is absolutely fail. Like in a knee joint replacement surgery, in that also, if physiotherapy is not given, patient cannot walk. If his muscles are strengthened, then only he will be able to walk. So I am talking about rehabilitation. If patient is really not treated, then we are think of rehabilitation. What we do is, patient's hand is working partially, patient's leg is working partially, he can walk but he is limping. So we are giving a particular splint. Splint means the ortho means the artificial, we are making artificial thing which is giving support to the hand. If fingers are not straightened, they are just in the position of fist, and they are not getting straightened. So we are giving him particular splint by which the hand will get straight, so that his hand will be in the working position, or he will sit on the computer, on the telephone, so he can keep his hand straight. If whole leg is proper, he is having strength, but just in knee he is not able to straight his knee, then there is a particular splint which gives proper support to the knee, only to the knee. If legs are working but back support is not there, then proper back support splints are also there, which gives proper support to the back. So we have to make out which is the weak part of the body, and that according to that the orthotic engineer will make the splint, and we will teach patient to the how to wear and how to use the splint. This is one of the part of the rehabilitation. Means we are not making patient cured, but we are trying to ensure that he will work whatever he was previously. He was a traffic police havaldar, and now he cannot be stand long time. So we will advise him any proper job. So that is the rehabilitation which I wanted to explain. Then I wanted to tell you about the scope. What is the scope in physiotherapy? Yes, please. Yeah. No problem. I'm sorry I did not tell you before. I can ask the question.
Learn this physiotherapy, and what are their challenges, and how do they deal? Let's say if they want to learn anatomy, so how do they learn? And if they want to learn something else, how do they learn? That things we would like to know more.
Right. Why some people are laughing? I'll continue with this question. Okay. See, after the HSC, if you decide to join the physiotherapy course, you go first day to the physiotherapy. You have a 3 years proper course of physiotherapy, right? You ask about particular about anatomy. You give the example. Now, anatomy में क्या होता है? You are given a structure of bone, muscles, joints, everything. So suppose if you want to know about a bone, if you want to learn about a bone, particular bone, hand bone, like humerus bone. So that humerus bone is given in your hand, and teachers are putting your finger, okay, this is the head of the humerus, this is the lateral border of the humerus, this is the medial border of the humerus, and here your bicep muscle gets attached, right? He is showing you कि here your bicep muscle it gets origin, and here your bicep muscle is insert. Did you get my question? Answer? Okay. Now I'll continue with the scope. Okay. Sorry. Scope of the physiotherapy is very large. You know, first off, I told you that physiotherapist is the important part of the rehabilitation team. You can, work in the government hospital. We'll start with the government hospital. There are very few examples I know. Only one person I know who is working in the government hospital, in the JJ hospital, right? So you can work in the government hospital as a physiotherapist or assistant physiotherapist. Then you have a polyclinic. Polyclinic means the clinic where many doctors are coming there. Orthopedic surgeon, neurologist, neurosurgeon, and we can also take part in the polyclinic too. We can set our particular timing, 2 hours or 3 hours in a day. So polyclinic is really helpful for the physiotherapist because other doctors are also coming. Who will send the patient to us? Patient will not come directly to us. If patient gets pain, patient think first to the orthopedic surgeon or neurosurgeon. Patient will not come to the directly to the physiotherapist. So we have to keep the proper contacts with the doctor also. We have to ask for the reference patients towards us. Then we can do job in a nursing home. Nursing home also they are also arranging for the physiotherapist because there are if particular hospital is related specialized for the heart, specialized for the brain operations, so specialized for the orthopedic diseases. So each and every disease except ear, eye and these things, each and every disease requires a physiotherapy. So in the nursing home also you can do your job. Then many VI patient, VR physiotherapists are organizing their own clinics. They are taking first few years experience, and they are putting their own clinics. That is one of the best scope for the physiotherapist. In the clinic also we can earn lot of money if we have the proper contacts with the doctors, right? Then we have a particular program by the government, like treating to the polio patient. Now polio is going on out of the treating for the cerebral palsy children. Cerebral palsy means the disease which is related to the brain and which is occurring to the children. So for the particular program which is arranged by the government, for that also physiotherapy is required. So physiotherapist work there also. Then we can do home visits also. Means patient cannot be going to the hospital, clinics. They need physiotherapy in home. So we have also a lot of scope in that field also. Freelancing. Many physiotherapists are going to the patient's home and doing their jobs for the patients, right? So this is the scope for the physiotherapy I talked to you. Now I wanted to tell you what are the problems for the VI physiotherapist for us. I did not really faced more problems if we have proper common sense and if we have proper skill of mobility and proper skill of talking, communication. if we have that things, then we really don't have the more problems. But of course the problem which is coming कि ये तो अंधा है कैसा करेगा ये, the same problem is coming. But if we really show them ना, I got the comments in the hospital, सर तुम्ही असं ब्लाइंड असून पण कसं करता. Then I show ki just you see and how I am doing. After that only they are saying ki yes खूप चांगलं सर आम्हाला बरं वाटलं. We should have the proper communication skill. How can a blind physiotherapist know the patient's problem? We cannot read the reports. We have to take the help for it. We cannot see the X-ray. We have to take help of the patient. So for us, we should have the proper skill of diagnosing the patient. There are tests also in physiotherapy. If you will join, then they will be teaching you the proper test for to recognize the disease. So we should have the proper skill of diagnosing the patient. Then we have treatment is really not important. Diagnosis is more important than the treatment. If we diagnose patient proper, then treatment is very easy. So to talk with the patient, that is a patient himself is giving whole his story, his history and whatever happening to him. So from his mouth only we will able to know his problem. Right? He is saying my knee joint is paining. But we have to see, ask the patient, where are you getting pain properly? Put your one finger at that point. Then we have to see that side of the knee, which side of the knee is getting pain. And you have to do the particular movement by which we will get the proper diagnosis ki he is having ligament tear or he is having just an muscle pain, just an bone pain. Right? So by doing the movement proper, we have the proper skill you will be taught. I am not going detail, just I am giving example. Ki we have to do proper movement as a test by which we will able to recognize the patient's problem. So talking to the patient is very important. Then now if patient is lying down on the bed and we are your senior therapist will say you ki he is having this problem, you have to go and treat him and give him this exercise. So when you will go to the patient, what you will do first? You are not talked to the patient before, but you are going first, you are going to meet him first time. What you will do first? First go to the patient and talk to him. How are you, sir? What is happening to you? What brings you here? So if patient will talk, then you will able to know if patient's head is which side and patient's legs are which side. Right? So first we have to talk to him and then only we have to go further. Right? And now